Hello everyone, I'm Jose Bernal and today I'm going to talk to you about a framework I've been working on for jointly assessing and reducing imaging artifacts automatically for improving the quantification of perivascular spaces in brain magnetic resonance imaging. So let's get started. Perivascular spaces are fluid-filled tubular spaces that follow the course of serial penetrating vessels, which are thought to play a role in serial hemodynamics and interstitial fluid drainage. In the image, we can see some of the perivascular spaces of the input image, of the input scan. Although they may be normal at any age, their enlargement and abundance have been found associated with aging, hypertension, serial small vessel disease, cognitive impairment, and also active inflammation. The automatic quantification of perivascular spaces can be compromised by imaging artifacts. On the left, we see an image of high quality, and on the right, we see the corresponding segmentation of perivascular spaces shown in green. Here is another example of the perivascular space segmentation in a noisy image of the same patient acquired during the same session. So we would expect subtle differences in PVS. However, this is not the case. As you can see, artifacts lead to errors in the segmentation and therefore in the entire quantification process. Some of the imaging artifacts we observe in the images are a consequence of the truncation of high frequencies during the acquisition of MRI scans. Such artifacts can be diminished by minimizing an energy function targeting them, such as the total variation optimization framework. In the image, we see how the phantom would look like if the entire case space was acquired. That can be seen in the left. In the middle, we see how the phantom would look like, if the case space was undersampled. So if we truncate high frequencies, we see some artifacts characteristic of this truncation process, such as ringing artifacts. And on the right, we can see the image in which these ringing artifacts have been diminished using the total variation framework. So we use that to enhance our images and better quantify perivascular spaces. For that, we propose a framework for assessing the quality of an incoming image, enhancing it if needed, and segmenting its perivascular spaces. So I will go now through each one of the steps in detail. So first, we classify an incoming image into low and high quality using texture analysis. For that, we extract hydraulic features from the input image, such as energy, contrast, correlation, homogeneity, entropy, and variance, and use a logistic regression model to classify the image into high or low quality. If the image is of low quality, we need to enhance it. And for that, we use the total variation framework as described by the formula. Note that there is a parameter lambda, which determines the smoothness of the filter, and that needs to be tuned up for the images that are to be processed. After that, we segment perivascular spaces in both the enhanced and high quality images in the basal ganglia and subtrochlear valley. We detect tubular-like structures using the 3D Ferenczi filter and take into account the count of perivascular spaces as well as the volume. For testing and validating our proposal, we use 60 T2-weighted images from a prospective study of mild stroke patients. The enlargement of perivascular spaces in both basal ganglia and central valley were visually rated and assessed by an expert neuroradiologist, and also an experienced image analyst classified images into low and high quality. Here are some qualitative results on the effect of a filter strength lambda. In the image, in the first column, we have the original scan. And as we move from left to right, the filter strength increases. And as expected, the smoothness of the resulting images increases and the visual artifacts decrease. But also note that there is a loss of visible perivascular spaces. Here is another example showing the same outcome. Note that there are many perivascular spaces in the basal ganglia in the original image that are not visible when lambda equals 5 and lambda equals 10. Through visual assessments, we conclude that a value for lambda equal to 2 gave an acceptable trade-off between detected PVS and artifact reduction. However, this does not imply that the quantification process was better because of the parameter value that we need to study in future work. We tested whether our texture analysis framework could discern between low and high quality images. For that, we split our dataset into 67% for training and 33% for testing, while maintaining the proportion of noisy images in both datasets. In this particular case, it was 30%. We observed that individual features did not obtain values above 80 in neither the training and testing. However, when we use them all in a single model, the AUCs went to up to 90 in training and up to 86 in testing. So we opted for using the model taking all textures into consideration. After that, we used the polyzero correlation to examine the relationship between clinical visual scores and computational measurements. Computational measurements were extracted from the original scans, from all filtered scans, and using our proposal, which is a selective filtering. We observed that the selective filtering strategy led to higher correlation values compared to the baseline in all cases, as you can see in the table, and comparable or higher values compared to when all images were filtered. So this shows that filtering is necessary, but clean images should not be filtered. So here are some final remarks. In this work, we proposed a framework for automatically reducing imaging artifacts while retaining clinically relevant patterns. We observed that filtering is needed, but high-quality cases should be avoided, or at least the strength of the filter should be lower or should be adapted automatically. In the future, we plan to improve our image quality assessment module to optimize the parameters of filtering and segmentation jointly, and to try some other image enhancement techniques. And that's all of it. Thank you for your attention.